It's my pleasure to speak with you this morning. My name is Dr. James Gammie, and I am System Chief of Cardiac Surgery at Johns Hopkins. And I presented at this weekend at the American Heart Association on behalf of my colleagues in the International Cardiothoracic Surgery Trials Network, the results of our trial, which was entitled Evaluating the Benefit of Concomitant Tricuspid Repair During Mitral Valve Surgery. Well, this is a very common question or dilemma that faces us as heart surgeons. One of the most common operations we do is for mitral regurgitation, degenerative mitral regurgitation. And it is frequent that there is some degree of tricuspid valve regurgitation that accompanies the mitral regurgitation. And we have clear acceptance amongst our community that we should fix the tricuspid regurgitation when it is severe. However, there is a lot of controversy over to whether or not to fix less than severe. So in other words, moderate or even less than moderate tricuspid regurgitation at the time of mitral valve surgery. And in fact, this is reflected in the current guidelines. Both the US guidelines as well as the European guidelines have a class 2A recommendation for repairing the mitral valve, the tricuspid valve at the time of mitral valve surgery under certain circumstances. But those guidelines are not supported by prospective randomized data. So it was on that background that we made the decision a number of years ago to conduct a prospective randomized trial to try and answer that question. And it was a fairly straightforward design. You were eligible to be in the trial if you had severe mitral regurgitation, degenerative MR, and were going for surgery. And you were included in the trial if you had either moderate tricuspid regurgitation or less than moderate tricuspid regurgitation and dilation of the tricuspid annulus, which, if you're interested in details, was absolute value above 40 millimeters or a indexed value above 21 to body surface area.